Good morning, everyone. My name is Hannah, and today I will be presenting my honours research project, which explored the experiences of occupational therapists as National Disability Insurance Scheme or NDIS service providers to children and their families. A critical shortage of allied health services has emerged with the introduction of the NDIS. The NDIS has also imposed a substantial administrative and financial burden on service providers, with 52% concerned that they will not be able to continue to operate under the NDIS as it currently exists. Challenges faced by allied health providers may therefore lead to a further reduction of service provider options and a subsequent erosion of choice and control for NDIS participants. A further reduction of NDIS registered service providers in particular will have an especially significant impact on the 28% of participants who are NDIA managed. Understanding the factors that impact allied health providers' participation in the NDIS is therefore fundamental to support the sustainability of the scheme and maximise its benefits for participants. However, there has been limited opportunity for researchers to document this, given that only 4 years have passed since the NDIS began its nationwide rollout. Our study therefore aimed to explore the experiences of Queensland occupational therapists as NDIS service providers to children and their families. More specifically, the aim was to discern insights into the facilitators and challenges to service provision and to identify ways in which barriers to their participation in the NDIS might be overcome. So to avoid confusing NDIS participants with the participants of this research study, I will refer to the former as clients throughout the remainder of this presentation. A formative evaluation of the NDIS was undertaken using a qualitative study design. The postal sampling was used to recruit occupational therapists who worked with children between the ages of 0 and 18 years and who resided in Queensland. The sample comprised a total of 9 participants from 3 groups of occupational therapists, which is shown on the screen. 3 semi-structured focus groups of approximately 60 to 70 minutes duration were conducted via Zoom and video recorded. These recordings were transcribed verbatim by the first author, and each participant was assigned a pseudonym. The transcripts were analysed inductively following Braun and Clark's 6 steps to thematic analysis. Initial analysis produced 226 preliminary codes, which were ultimately refined and organised into 4 final themes and 8 sub-themes, which takes us into the findings of the study. So the first theme is perceived benefits of the NDIS. The participants identified various benefits of the NDIS for occupational therapy, NDIS clients, and the therapeutic relationship. These were organised into 3 sub-themes as shown. Participants perceived that the principles of the NDIS aligned really well with the core philosophy of occupational therapy practice. Benefits resulting from this included a broadened vision of possibility for practice and an increased respect and recognition for the profession, as demonstrated by this quote from Lisa. Benefits for clients included an increased sense of empowerment and reduced financial stress. The NDIS was also perceived by participants to facilitate rapport building and collaboration with parents, as demonstrated by these quotes from Amy and Sue. Despite these perceived benefits, many complex and interrelated challenges for service providers were identified. This takes us into the second theme, which consisted of 3 sub-themes. The substantial restructuring of the disability sector left participants with the challenge of navigating changes to the magnitude and nature of service demand. New rules and policies and guidelines also left them with the challenge of navigating changes to report writing and how and where they could provide therapy supports and services to children and their families, as highlighted by this quote from Sue. Navigating these changes was overwhelming and stressful for participants. Participants also expressed frustration with navigating onerous bureaucratic requirements and processes. In particular, the administrative burden and cost of the registration audits was identified by participants as a key barrier to registering with the NDIA, with participants expressing further concerns that these audits were unreasonable and unnecessary for professionals who are already registered with the Australian Health Practitioner Regulation Agency, as indicated here by Anne-Marie. Concerns were also raised that the audits actually undermined rather than safeguarded the quality and safety of services, as highlighted by this quote from Yvette. The title of the second sub-theme, Working in the Dark, encapsulates the participants' experiences of navigating the aforementioned systemic changes amidst unclear expectations and requirements around report writing and service provision. This lack of clarity resulted from factors including ever-changing rules and inconsistencies in information provided by different NDIS staff and planners. The third subtheme identifies challenges unique to occupational therapists, with participants highlighting the pressures and stress they experience from being recognised among NDIS clients and planners as the go-to professionals for anything in the too hard basket, and the kind of gatekeepers for access to NDIS funding. The third theme, ethical dilemmas, consisted of two subthemes. The first subtheme focuses on the tension between autonomy and justice. Participants highlighted how the principle of autonomy upon which the NDIS is founded creates an uneven playing field for families. Those who knew how to play the game benefited from this principle. Meanwhile, others who lacked the resources or capacity to enact choice and control were significantly disadvantaged by it, resulting in an inequitable distribution of funding and services. NDIA managed clients were perceived as especially vulnerable, as indicated by this quote from Joanne. The second subtheme identifies the potential harm caused from some families continuing to engage in therapy long after it is deemed necessary. Participants spoke of how this overservicing has contributed to increased wait lists and caused burnout among some children. This issue also impacted participants' job satisfaction and overall well-being. The final theme is It's Getting Better, but overcoming identified challenges and barriers. Overall, participants acknowledged that the implementation of the NDIS has improved with time, but that further improvements are required moving forward. Participants identified various ways in which existing challenges might be overcome, like improving communication and providing training for NDIS planners. Participants also strongly agreed that the duplicated regulatory demands imposed upon already registered therapists should be removed, as indicated by this quote. Furthermore, opportunities for professional networking and mentoring was perceived by participants as important for new graduates, given that their collective capacity to work within such a large and complex system will have significant implications for the future success and long-term sustainability of the NDIS. So although the NDIS is a promising scheme, several challenges undermine the equitable access to and provision of therapy services. Importantly, feelings of stress, frustration, and burnout were reported by the participants. This has potential implications for the sustainability of the scheme and its benefits for clients, given that burnout is strongly associated with high turnover rates. Overcoming existing challenges is therefore fundamental, and our findings open a preliminary discussion about ways in which this might be achieved. It is important to acknowledge, however, that this study consisted of a small sample of participants from a specific geographical location working in one area of practice. The scope of this investigation should therefore be expanded in future to include other allied health professionals as well as NDIS clients in all states and territories to better inform ongoing policy development and implementation. Thank you.